already know. Urine analysis shows numerous leukocytes, but no bacteria. What does that mean? These are intracellular organisms, because if you see leukocytes, that means infection, intracellular organism. So what's the problem here? If you think orchitis, then you should go for A. Is that clear, folks? If you think orchitis, that means they didn't get the mumps vaccine, MMR, okay? It is not this, it is not this, it's not this. Unprotected sexual intercourse, because one is young. Number two, how do I know it's an intracellular organism? That's why no bacteria, because see, Trichomatis and gonorrhea, these are intracellular organisms, folks, okay? So that's the answer. Is that clear, folks?
Dr. Roy, what's sterile pyuria? Is that what that is?
Sterile pyuria mean yes, your urine has just leukocytes, but no bacteria. So that means it's indirectly telling intracellular organisms. Okay, that's the idea. Oh, nobody can miss this question. If one person missed this question, we start neurology tomorrow. That's my favorite topic. So I'm waiting for it. So anytime you suspect, if a malignant, this patient tumor most likely spread where? So basically they're asking, where does the drainage for testicle? Is that clear, folks? The answer should be, let me see if anybody missed it. You see, people are not even answering nowadays. Hey, listen, not answering versus wrong answer is the same thing, right? So it's para-aortic lymph node. Is that clear, folks? So when do you pick superficial inguinal? Then you have a scrotal infection, the skin around it. So, okay, careful, folks. This is important. Look at that. Okay, that's that. All right. Ooh. In this question, you basically have to identify what? Prostate gland, right? That's all. How do you identify prostate gland? Is it hard to identify in this picture? Look at this. This is a cross section. I don't see a normal vertebral bone. Usually this is where the big vertebral bone is, right? Why I see a tiny one? Because that sacrum, as it goes down, the sacrum become coccygeal bone, so tiny. So this is a back posterior. That's a symphysis pubic, the anterior part. Yeah. Now you have, of course, you should know it's not A, it's not F. A is a rectus abdominis. F is paraspinal or psoas major muscles. So your answer has to be B, C, D, E. Okay, E is the space in there. It has to be B, C, D. What is D? That's your rectum. How do I know it's a rectum? Because you have air in the rectum. Is that clear, folks? You cannot miss that. Right anterior to the rectum is prostate gland. C is the answer. Okay, so that's rectum. What is B then? Uterus? No, it's a man. No, I'm kidding. That's urinary bladder. That's urinary bladder because that's right in front, right? So that's the idea. Let's speak. Look at that. That's a bladder. Bladder, prostate gland, anal canal. Is that clear, folks? All right. Good. Any question in here? You should take a picture of this. That needs to be collected. All good? All right. Let's go to pharmacology. Now remember, folks, when it comes to reproductive, quickly before I start, there are some topics we skipped